to have a conversation about Mindit. Now, Mindit this is a discovery second. I'm introducing to you Mindit. Now, Mindit, very interesting idea. COVID has been with us for some time, and it's creating all kinds of mental stress situations. Now, I have two brothers with me. They're going to be talking to us about their idea of what they can do to help the situation. Yes, we're talking about depression, we're talking about psychosis, we're talking about all kinds of mental issues here. But Mindit is here to be that stopgap measure to at least help out in this situation. There are two brothers, but not just brothers. I just found out they are twins. Okay. So Adam Latte and Dr. Achu Latte. Now, Adam is the president of Mindit Ghana, and Dr. Achu is the medical doctor and CEO at Mindit. All right, so my twin friends, you're welcome.
Thank you.
It's good to have you here. Now, let's start with where did this concept, tell us what Mindit is all about, first of all, and where the concept was birthed.
Okay.
Any of you can take it.
Good morning, and then thank you. Good morning to your listeners. So Mindit is a group of youth who came together in 2017 to combine their skills to develop innovative tools to screen the population for psychological distress and then provide them with affordable and accessible mental health care. So our main goal is to help people gain access to affordable and accessible mental health care. I began it when I was a medical student that's in 2017 to try to bridge that gap to access to mental health care. So we basically put our skills together and then develop tools that screen the population for psychological distress.
Okay, what was it that made you say, let's help in the area of mental health?
Okay, so I had an experience when I was a medical student in fifth year. I wrote an article on depression in the Mirror newspaper, and then someone contacted me from far away in Kumasi that she actually saw it and she identified herself as suffering from those symptoms. And long and short of it was that I wasn't able to get her to a center that could provide her the care that she could afford. And even the center I got was quite expensive for her. So I thought, why don't you find a way to help provide that affordable, accessible mental health care? And we wanted to reach a large portion of the population, so we decided to use some innovative technology for that. So that's what sparked Mindit, actually.
I see.
Yes.
So if I ask, when you say innovative technology, explain to us how it works.
Okay, so there are a couple of them. Our flagship one is our short code. So we have a toll-free short code. It's free on all networks in the country. You don't need data, you don't need airtime.
Okay.
It's *8.
You don't need data, you don't need airtime?
No.
Yeah,
it's
okay.
*844 *555#. So *844 *555#. You dial it and then we provide responses to the questions there, and then we'll call you and then provide you with affordable, accessible mental health care if you need the help.
I see.
Yes.
Now, since you rolled this out, what's been the impact as far as the idea of the business itself is concerned? Then we'll look at the impact on the populace.
Yes.
Yeah.
So we've had well over about 2,000 users since we began. We've screened about 2,000 people with a short code. Some were just prank users, some actually required care, some actually declined care as well. We've been able to provide about 120 clinical visits for the people that we screened, as those who needed care and those who had significant conditions.
Okay. Yeah. What would you say are some of the things that, as you're developing this program or project that you're on, are your things that you're looking to, you've noticed as maybe hiccups or hitches within the system that you're looking to fix and maybe extend further into the population?
Okay, so I'd say that, okay, so basically I don't have any medical background at all whatsoever. So I think it provides a neutral platform for me to speak on behalf of people who are not in the medical field.
Okay.
Yes. So I'd say that first off, I have noticed that there's been a lot of stigma with regards to mental health and the topic at large.
True.
So stigma because one, lots of people are not willing to talk about it because we are in a highly religious, culture.
You think religion has everything to do with it?
I would
Or
say
something to do
everything,
with it?
yes. I think it has
Something to do with it.
a large extent something to do with it.
Okay.
Now, I'm not saying that's bad because I came to realize along the line that, whatever way people are able to cope with daily stresses works just fine. And religion also plays a very active role in that. But in the sense that it impedes people from talking about these problems,
Okay.
in a typical Ghanaian society, if let's say you had an issue with depression, you probably aren't feeling well for a very long duration, and you told maybe a relative about it, or say your parents about it, the first response you're most likely to get from a typical Ghanaian parent is, "Oh, pray about it," and basically that's it. So people aren't able to talk about it, one, and I have come to realize that it's also created this problem of people not actually realizing that they're suffering from mental health, problems, because it's been downplayed from the onset, and so people actually don't even realize that it's so much of a problem that needs medical attention. And just to add to it, mental health, for the most part, in my experience, has been linked to madness. I've had conversations with lots of people, and when I say, probably I introduce myself as the president of a mental health, and they're like, "Hey, so you deal with people who are mad."
The madman person, the one who deals with madness.
So, for the second part of the question, I'd say that we're hoping to spread education along the lines of mental health and get people to actively talk about these problems without having to feel, any stigma for it.
Now, this is actually something that I'm very passionate about myself, the whole conversation about mental health and mental health advocacy. One of the things I'm wondering about is when you have a situation, let's just talk about a hypothetical situation, which maybe not so hypothetical because people do go through these things, but imagine you meet somebody and they come to tell you that, look, I went to tell my family that I was going through these issues, and they said, hey, the village people have arisen again. They are starting to worry you. Because the first thing they can think about is that it must be something spiritual. It must be something otherworldly, and not something that we can deal with because we can't see, we can't touch, right? How do you cross the bridge there and try to let people understand that as much as you can't touch it, it's not tangible, it's still natural, it's still very much present with us. It's something that we deal with as human beings. How do you cross that?
Okay, so that's where community engagement is extremely important, and you realize that the home or the family is the primary agent of socialization for every individual, so they are very important in taking care of someone who has a mental health disorder. So if you want to tackle stigma largely, then you have to employ the family or the person's immediate relatives. That's one thing our system, our service seeks to do. We actually work with some community mental health officials, and what they do is that they don't only administer care in the hospitals, they actually perform home visits and then closely involve their parents or their relatives in the management of their patients. So it's a multidimensional approach.
Okay.
There's education to us also. Their relatives are able to actually see and appreciate the improvement of the person who's suffering from the mental health disorder on medication or some form of psychotherapy. So the community mental health approach which we employ, which is an integral part of our system, actually ensures that that stigma is actually reduced.
Dealt with,
So that's one key feature of our system, our program.
Adam, the pre-COVID, I mean, you started in 2017. So pre-COVID, what were some of the experiences, and juxtapose that to COVID mental health situations? Do you find that there's more stress, mental health is more challenging? the situation is more challenging in Ghana. What do you find?
Okay, so I have two answers to this particular question. One from the point of the experience from the users, and then what COVID is now trying to make the new normal in terms of communication. I'm seeing that there's lots of social distancing. So with pre-COVID and user interactions, I would say, again, coming from a non-medical point of view, that I was rather pleasantly surprised that people were willing to dial the short code and talk to people over the phone. I came to realize that it's easier for people to talk to someone who they can't put a face to, who they know that they can't put a face to them as well, and point them out in the streets, to make them feel like, I know whatever challenges you're going through, right? So in that regard, again, I've been pleasantly surprised that people are able to use the platform to reach out to us. Now, mental health, to me, hasn't been giving so much importance globally. It's not just a Ghanaian problem, it's a global thing.
Oh, really?
Yes, it is. But COVID, with all the stresses that people are having to deal with now, global economies crashing and people losing their jobs because of layoffs, breadwinners not able to provide for their families, more responsibilities, more financial obligations, lesser jobs or fewer jobs. What this has done is essentially it's created more problems for people, and people are having to deal with more stress as is now. So you find more people susceptible to stresses, and going through lots of depression and other mental health challenges as well. So
now we have some infographics on the impact of COVID-19 on mental health. Let's take a look at that and see if you can walk us through some of what are we looking at there.
Okay, so this was a study that was carried out in that's last year during the first 8 weeks of the COVID outbreak in the country. So they actually sampled about 8,661 people, and then they tried to find out how they were feeling that during the COVID situation. So you notice that about 3.1% said they were feeling particularly low or down. That was during the COVID situation. About 26.8 reported that's little of that particular feeling. So you'd have people, about 3.1%, that's exhibiting some symptoms of that's depression. That's if it was more than for more than 2 weeks. So this as regards the very first one. And now with a very second one, that's some who thought they had thoughts of taking their lives. You'd also realize that a significant number of them, about
thoughts of ending their life.
Yes, thoughts of ending their life. So that's an aspect of that suicidality. They might have been stressed so much to the extent that they actually contemplating taking their lives. You find a significant number of them in percentage actually contemplating that. And mental health disorders are the largest underlying causes for people exhibiting some suicidal behavior. Now the third one is people feeling anxious.
So this one there, you're looking at the people thinking about ending their life. We have 2,205 people out of the sample size.
Out of
that's a lot.
That's very sick. That's staggering.
Wow.
That's staggering. And that forms about 25.5%, which is extremely large. Then the very last one about feelings of anxiety as well. About close to you'd have about 20-something% of them also saying that they were feeling very anxious during the period. COVID came with having to wash your hands, being scared that your family or relative might actually contact the infection. So these show the significant impacts or effects that the COVID-19 had on people's mental health. They are staggering effects.
So let's look at Mindit and in terms of advocacy, and that's mental health advocacy and further impact looking forward. What are some of the things that you're engaging in? What are some of the things that you want to drive even harder that you've already been doing? You can just share some of that with us.
So when we began on that quite a very a low scale. And we realized that from the statistics that we've seen, we realized that there's actually a great need of mental health care out there. So sometime last year, we secured some funding from some charitable individuals and organizations and set up our own workstation, which comprises a call center and then an office for the management team. We intended to create an innovation corner in there where we would have people doing some internship to create more innovative tools to solve the mental health problems Ghanaians have. But due to some severe financial constraints, we haven't been able to set up the innovation the innovation corner within our facility. So that's one of the main things that we are seeking to do. With some, should we get some public support, we'll be extremely glad for that. But we have an office specific call center with someone who is willing to, who is actually working to make calls to distressed individuals. We have a small office, and then we are working on the innovation corner too.
Fantastic. We have a message here. It says, I work as a first responder to COVID, and I can tell you that COVID-19 is real and is claiming lives before their time. So protect yourself and your loved ones by observing the safety protocols. This one will pass soon. Thank you for that message there. I want us to harp on the short code again, because I think that knowing that this is an innovation that's available, I think people should engage in it. And I like what Adam said, that a lot of people are using the short code because you don't know my face, I don't know your face. I'm comfortable telling you my issue and hearing a solution without having to think about whether you will see me in the streets and point me out, that, oh, that's that one going there. No, so I think let's put it out again, the short code.
So the short code is *844*555# hash. That's *844*555# hash. That's the short code.
All networks.
On all networks.
On all networks. Okay, so I like this thing you have here. You said that if you're experiencing any of these things, unexplained and excessive worry, fear, which interferes with your daily activities. Do you have any fears, worries, unexplained? You don't know what is causing you. You are just afraid. You're just worried. And it's interfering with your daily activities. Don't forget the short code. *844*555#. Also, if you're experiencing extreme sadness, loss of interest in the things that you used to enjoy, if you are thinking of yourself as worthless, hopeless, or you want to end your life, hearing or seeing things that don't exist, if you hear something, you turn around and there's nothing there causing the sound that you heard, that's also a problem. Don't forget the short code. It's *844*555#. Any final thoughts or final words you would like to share?
Okay, so I would say for the youth out there, right, I'd basically just challenge everyone to find ways and means to solve daily problems, because we live in an era where there's abundance of information and there's lots of technologies out there that we can leverage on to provide solutions to any problems that we have.
Actually, do you find that these challenges affect a particular age group of people as opposed to others? Or is it like generally evenly spread across the population?
Yes, so most mental health disorders actually begin the period of adolescence due to the changes adolescents experience, mainly in the periods of 15, and it can extend to about 35 years. So you have most mental health disorders occurring in such age groups, but then they can actually occur in other age groups as well, but it's more prevalent in those from 15 to 35 years.
15?
Yes, 35 years. Yes, most of the mental health disorders.
Wow, I see. What is it that makes older people not experience what they probably would have experienced when they were younger?
Yes, so to begin with, older people are also likely to experience them, but then it's more pronounced in the 15 to 35 year age group. So everybody has a chance of that's experiencing a mental health disorder. But it's more prevalent in
the
the younger people because of the changes they're experiencing, pressures, societal pressures as well. Yes.
Yeah. So I think older people should give young people a break. And not stress them out so much.
Yes,
they're already going through a difficult time.
Yes.
But it's funny how our society, we rather think that younger people don't have a care in this world. So why are they stressing out about nothing? Yeah. Anyway, thank you very much. I say a big thank you to you, Dr. Achu Latte, and also to Adam Latte. Thank you very much for joining us here on Breakfast Daily. This has been the Discovery of the Week. Mindit. Contact them on the short code. And all those of any support, where can they get you? You have social media handles? You have?
Yes. We have social media handles. So on Facebook, we are MinditGH. On Twitter as well, also MinditGH. So you can actually get us on social media.
MinditGH.
Okay. And our email address as well. So minditgh@gmail.com.
Okay, so that's your email address.
Yes, please.
And if anyone wants to support us as well, you can actually reach us on minditgh@gmail.com. If you want to join us to make impacts in the lives of people, just to us a mail, minditgh@gmail.com.
All right, super. You've been speaking to the brothers from Mindit. We'll be right back after these messages. Don't go anywhere.